This webinar is really supposed to be done in person and in a group. However, we're recording it for people who have attended and want to go over some of the things we've discussed, and also for people who we were unable to accommodate in the group programme. So the very first thing I want to stress is that your pain is absolutely real. Pain is not your fault, and that the pain can get better. So we will be recording each week of the programme as we go through them. So week 1 is already live on our website, and hopefully you've had a chance to watch this. So what we're going to discuss this week is, how do you know if your pain alarm is hypersensitive? We're going to discuss pacing, and we're going to discuss techniques to improve pain. The next webinar will be about stress, mental well-being and pain, and techniques to improve pain. We won't record week 4, which is a patient journey. Week 5 will be about medication. Week 6 will be about sleep and nutrition, and week 7, physical activity and next steps. So over the next 6 webinars, we hope to empower you to take control of your pain, calm its influence, and bring your mind and body peace. Give you tools that will enable you to move positively forward and reclaim an enjoyable, fulfilled life. Help you understand you can improve your pain and make your quality of life better, and discuss how to be more self-compassionate. So I'm just going to play a very short video clip about neuroplasticity and how it works. We've already covered quite a bit of this in the first webinar, but this is just a different way of looking at it. So how do you know if your pain is neuroplastic due to a hypervigilant brain rather than a physical cause? So often the pain will have originated without an injury or persist long after the original injury is healed. So we'd expect most injuries to heal within sort of 8 to 12 weeks. So if your pain's persisting much beyond that, there's a reasonable chance it's neuroplastic. With neuroplastic pain, symptoms can often start in one part of the body, but then spread or move around. Sometimes the pain can have delayed onset. Often there's a large number of symptoms that can go along with it. Often people have been extensively investigated and we can't seem to find a physical cause for the pain. Quite frequently, people will have been given multiple different diagnoses from different healthcare practitioners, which is obviously very confusing. Sometimes the symptoms can be triggered by stress, and sometimes you can have triggers that have nothing to do with your body. Often you can start off with pain on one side and then it will spread to the other side, which is unusual with a physical cause. neuroplastic pain is more common if people have a history of childhood adversity, and it's also more common with certain personality traits, particularly perfectionism and people-pleasing. So conditioned responses are important because they protect us from repeating dangerous behaviours. They do this by creating associations between specific activities and adverse outcomes. But the problem is that the brain can sometimes make mistakes and can create associations between safe activities and adverse outcomes. So as you can see here, this dog is very friendly and not going to cause any problems. So the medical profession are often part of the problem. You know, we're trained in a very medical model where we're trained to look for a structural cause and then to fix it. And when we look for a structural cause, we're likely to find one, even if that's not what's causing the problem. And obviously, if a doctor tells you there's a structural cause for your pain, you tend to believe it, but sometimes the doctors can be wrong. And often for people who have chronic pain, this way of working is really unhelpful. As doctors, we're not very good at saying we can't find any cause for your pain or that we don't really know what's wrong. And I think often that leads us to make explanations or attribute symptoms to some minor finding on an X-ray or a scan. So this next clip relates specifically to MRI scans, but the same can be true for X-rays and so on.
All MRI scans are abnormal. If you have neck or back pain, you'll probably get an MRI scan to figure out what's wrong. But there is something you should know about MRI scans of the spine. A radiologist will find something wrong nearly 100% of the time. But that may not tell us anything about where your pain is coming from or how to treat it. Let's back up. The MRI machine produces a lot of pictures that slice the human body into thin sections. This technique allows us to visualize anatomic structures from any angle and direction. An MRI image looks like a photograph, but it is actually a computerized image of the molecules inside the human body. These images are superior to CT scans and X-rays. The resolution and clarity of the images is amazing. We can see unbelievably fine detail, and we can visualize the smallest details of normal and abnormal human anatomy. On an MRI scan, we can clearly see the intervertebral discs, spinal cord, and nerve roots. We can see things that we would expect, like normal wear and tear, and things that signify that something is wrong, like a tumor, infection, fracture, or a large herniated disc or severe spinal stenosis. Here's the problem. Once you are older than 20, your spine has 20 years of bending, lifting, twisting, and the scan will show some signs of normal aging. It is the radiologist's job to describe in great detail every single thing that is not pristine on your MRI scan, whether it is relevant to why you are having pain or not. A list of things that a radiologist will find on nearly every MRI scan includes disc desiccation, disc degeneration, disc bulging, small disc herniations, annular tears, mild spinal stenosis, and neuroforaminal narrowing. Here is one way to understand what is happening here. If you look at these two pictures of a young baby and an older gentleman, you are not surprised to see that the skin looks different. Why not? We are aware that the natural aging process causes changes to every structure of the human body, and we are used to seeing our faces and our skin change every year. The spine is no different. If we were to look at the skin of the gentleman on the right with a microscope, we would see evidence of degeneration, loss of elasticity, causing loose skin and wrinkles, growths such as skin tags, and pigment changes, such as old age spots. These findings would all be described as abnormal. However, we could also describe the skin on the right as normal for age. We only describe it as abnormal when we compare it to the image of the baby on the left. Most people, even if they don't have any back pain, will still have evidence of abnormalities on MRI scans. Disc degeneration, bulging discs, and herniated discs occur very commonly, and they may not be causing symptoms of pain. For example, in a paper published in the Journal of Neuroradiology, the researchers found that approximately 90% of people without any history of back pain in the last 6 months still have evidence of annular tears, disc degeneration, and disc bulging at one or multiple levels. It is also the key to understanding the mind-body connection when it comes to back pain. This chart from this article is the most important piece of data in the study. It's a summary of the results of over 3,000 MRI scans of the spine in people who have no back pain. You can see that as age increases from left to right, the percentage of scans that have evidence of degenerative changes increases every decade. Take disc degeneration, for example. It's the top row. 37% of 20-year-olds have MRI evidence of disc degeneration, increasing to 96% of 80-year-olds. Again, these supposedly abnormal findings are seen in people with no back pain. Therefore, the critical task when it comes to interpreting an MRI scan is correlating the findings on the MRI scan with detailed information about where your pain is located, and also with a physical exam. If your scan shows severe stenosis, a fracture, an infection, or a large herniated disc, it may be revealing the cause of your pain. However, if it shows disc bulging, disc degeneration, annular tears, or facet arthropathy, it would be much better if the radiologist described the MRI scan as showing natural changes that occur to the spine with time. Remember, your scan is going to be abnormal, nearly 100% of the time. There are few findings, such as a large herniated disc, severe spinal stenosis, infection, or instability of the spine, that indicate that you should see a specialist soon. If none of these things are present, chances are that your MRI scan is not helping us understand where your pain is coming from. Wrinkles and loose skin do not cause pain. They are normal changes. The same is true for most of the abnormalities seen on MRIs, even if you have neck or back pain. To figure out what the source of the pain is, we usually need to look elsewhere. For example, in the brain, which is where all pain comes from.
Okay, so if that has raised any questions for anybody who may have had an MRI scan or an X-ray with an abnormal finding, if you contact the surgery and book a routine telephone consultation with one of the doctors, and we can discuss it with you in more detail. So the next thing I'd like to move on to is about pacing. This is something that's really close to my heart because we often see a lot of patients who are caught up in the boom and bust cycle. So what happens is you're having a better day, you think, great, I can do some of those tasks that I've been unable to do because I've been so sore, and then you do far too much. Then your pain gets much worse. You then take several days to rest and recover. And all this is really doing is reinforcing with your brain that you can't do these things, that they'll cause pain. So if we have a look at this diagram, you can see that if you go for the base and pace method, actually you will improve your activity levels much more than with the boom and bust cycle. So what we generally suggest is you start off with what you can do on a bad day and increase that by maybe about 5%. And then you do that level of activity every day for at least a fortnight without, it doesn't matter whether you're having a good day or a bad day, you just stick at that level of activity. Then after a couple of weeks, hopefully you'll be able to increase again just by a small amount. and then do that again every day for a week to 2 weeks, and just slowly build up. Now, you may have find that something happens and you have to step back down a wee bit again, but then just back to the same thing. And hopefully over time you should find that actually you can increase your activity level quite significantly, and all the time this is reassuring your brain that you are safe, rather than reinforcing the message that activity will cause you pain. So when you're trying to make changes, we normally suggest that you start with small habits rather than having this really grand, ambitious goal. It's better to start with maybe 5 minutes, 10 minutes. And it's also really important to have quite clear goals. So we generally talk about something called SMART goals. So it should be really specific. You should be quite clear what it is that you're trying to achieve. Measurable, so that you can see that you've achieved it. Everybody likes to achieve a goal. And it has to be something that's achievable. It's okay for it to be challenging, but there's no point in setting goals that are just completely unrealistic, because all that happens is you can't meet them. And then again, it just reinforces this feeling that you can't do something. Ideally, you want to set goals that are relevant to your overall aim. So if that's, for example, you want to be able to take your grandchildren to the park, or you want to be able to stand in your kitchen and cook a meal, ideally you want to set goals that will help you achieve that. And it's always good to have a timeline. So rather than saying, I'm going to walk more, you might say, I'm going to go for a 10-minute walk every day this week before lunch, and I'm going to walk around the block. And that saves every day you having to have the pressure of, when am I going to do this? Where am I going to do this? Because you've just made the plan in advance. So next, moving on to retraining the brain, which is the key to recovery from chronic pain. Hopefully by this stage we've explained how your brain has learnt pain, and the fact that these pathways can be relearnt. So the first thing that's really important when we're trying to do this is to reduce the fear and increase your brain's feeling of safety. So fear can also be increased by what we call the 6 Fs. So fear of the pain, frustration about what the pain's stopping you from doing, trying to fight the pain, focusing on it too much and trying to figure it out, come up with a solution, and trying to fix it. So all of these things just really focus your brain on the pain. So trying to reduce all of these things can be really helpful. So a few things that might be helpful to work on. The first is a list of exceptions, some breathing exercises to calm down that fight or flight sympathetic nervous system, and also somatic tracking. So what we're really trying to do is to prove to your brain that this pain is being generated by an overactive pain system. And ways of doing that are to look at when the pain doesn't happen when you might expect it to. So for example, you might be pain-free on the weekend, but then the pain starts again just before you go back to work. You might have back pain when you're walking around at work or in the city, but actually if you're outside, the pain is less. You might find when you're sitting at work, you get a lot of pain, but you could be out with friends having a coffee, and because you're caught up in the conversation, the pain isn't there, or it's not as bad. Pain that varies throughout the day. Pain that gets worse with stress, or if you can have a couple of days with no pain and then the pain comes back. Another thing that can be helpful is to look at a timeline of your pain. If you look back at what was going on in your life and some of the symptoms you had at that time. Sometimes you can start to see a correlation between sort of big life events or a series of small life events and the pain changing or worsening. The other thing that's really helpful for calming down in the stress system in your body is breathing exercises. So I'm just going to play a short video of Yoga for Health's focusing on the exhale.
Ocean breath on the exhale. Find a comfortable seated position. Keep the spine upright, shoulders relaxed. Ideally, feet are flat on the floor. Close your eyes or have your eyes in a downcast position, soft focus. And take a moment or two to check in with your body, how you're feeling right now. And with the mind, is the mind settled or agitated? And bring your focus to your breath, breathing in and out through the nose, unless the nose is blocked. And after a couple of easy breaths, we'll begin our ocean breath on the exhale practice by creating a soft sighing sound through the mouth as we exhale. And when you've done 2 exhales like that, close the mouth halfway through the exhale to transfer the soft sighing sound from the mouth to the nose. So you're now inhaling normally through the nose and exhale ocean breath through the nose, creating a subtle, soft sighing sound, which is emanating from the throat. Without any strain on the breath, invite that exhale to be a little bit longer than the in-breath. And this should naturally happen with the technique of ocean breathing. And we're doing 5 more breaths of ocean breath on the exhale. And after the final exhale, take a moment to notice how you have shifted, how you feel in your body, your state of mind, to hopefully a more relaxed and settled state. Blink open the eyes whenever you want to. And know that you can deploy this technique in a couple of minutes at any time of the day when you're under particular stress, or you just need to check in with yourself and reconnect with your body, your breath, and steady the mind.
Okay, I hope everybody found that helpful. So we're going to touch on somatic tracking in this webinar. However, we will discuss it again next week. So somatic tracking is really paying attention to your pain, but without the emotional response, without the fear that goes alongside it. So it's really important not to do this exercise if your pain is particularly severe. So if your pain is normally 8 or 9 out of 10, if you wait until it's maybe nearer a 2 or 3, or if it never gets as low as that, even a 4 or 5. How long you do this for is very much up to you. You might want to start off with really a short time, just maybe a minute or so, and then build up depending on how things are going. It's important not to do this when you're feeling stressed or harassed or you don't really have time. And the idea is that you take a few deep breaths and then you focus on the area that's causing you pain. And rather than thinking about what that pain might stop you from doing, how frustrating it is, all you're really doing is thinking, how does this pain feel? Is it sharp? Is it burning? Is it stabbing? Does it move around? Is it right in one place, or is it over quite a big area? And really, you're just noticing the pain, and try and do that with just a sensation of lightness. So you're just curious about what the pain actually feels like. You're not trying to achieve any particular goal. That's really important. If you're focusing on the pain really, really hard, or you're desperately trying to make it go away, then that increases the stress in your brain and actually doesn't increase messages of safety. And, when you're thinking about the pain, all the time you're thinking, I know I'm safe. I'm not going to harm my body by moving. This is my overactive pain center that's causing this pain, and I know that I'm safe. And I think this is something that sometimes may help and sometimes it may not. Some people might like to do it 2 or 3 times a day. Some people might do it every other day. And I think it's just when it feels right for you to do it for the length of time that feels comfortable, but not to feel like it's a chore. It's something that you want to really be quite relaxed about. So that's the end of the presentation. As I say, if it's raised any questions for you and you're not in our pain group, then please by all means book a routine telephone consultation to discuss any questions you might have with the GPs. I hope this has been helpful, and thanks for watching.